Okay, good evening, everyone, and thank you so much for coming in today despite your busy schedule and very, very dreadful weather. Today, we're going to talk about our post Haiti trip rotation last year that we've been through in March of 2018. First, I'll give you a brief overview of what the rotation is about and how it all started. It all started with an OBGYN physician named Dr. Hines, who was actually taking students to Haiti several years ago. And then later on, Dr. Toussaint joined him in. However, both of these physicians moved out of town and the rotation wasn't happening anymore, unfortunately. But because we thought it was so helpful, not only for the students, but also for the population of Haiti, I thought from being from Haiti, maybe it's a good idea to kind of help put the rotation back on track again, which is the reason why we're here today. I met with Dr. Plett one day and I asked her to join us, and she immediately said, yes, why not? And then Dr. Holden, who actually speaks French, OBGYN, I asked him, also approached him to come with us to the trip, and he also said yes, without hesitation. And then we reached out to the students. We had Rennie, Claire, Stephanie, and Caitlin answering to our call, and they were all committed from the very beginning. So commitment is a very strong word, and I believe, once you're committed, you hold on to your yes, magic can happen, and you can be successful. So I'm very proud of the team, and thank you so much, very much, for going to our trip and making a success. So first, I will talk to you about a little bit of overview of Haiti and so forth. And the topic of our presentation today is Lessons in Humanity from a Neighboring Country. Oh, let's back up a little bit. Can anybody see I know it's dark, but can you see the shirt that this man is wearing? You're probably wondering, why do we have this picture up there, right? He's actually wearing a Cubs shirt, Chicago Cubs shirt. And he's never been to Chicago. I don't think he even knows where Chicago is, but still, he was supporting the Cubs. So we thought that was really interesting, and we put him up there. Well, this is our team here. If you go from left to right, we have Claire, M3, now M4. Then we have Dr. Caitlin, who's now an OBGYN resident in Chicago. Dr. Holden, Rennie Matthew, he's here with us today. Dr. Jimmy Plett, he also here. Stephanie, who could not attend this meeting today, and myself. This picture was also taken at the airport when we first arrived in Haiti. What are going to be our learning objectives? First, we're going to take a brief overview of how Haiti is, what do you know about Haiti, and then we'll talk about cultural differences in healthcare, the United States versus Haiti, and I'm sure you're thinking is very different. Then we'll focus on history and physical rather than imaging. So this is very interesting. In Haiti, we focus a lot on a good history taking and physical exam rather than ordering a lot of imaging studies like CT scan and MRIs, because we really don't have them available all the time. So a lot of the diagnoses are based on history and physical. That's very important. And then we'll talk about embracing priorities, the skills that were needed to function while working and volunteering in Haiti. We'll talk about opportunities provided to the medical students and the physicians who were there, how to appreciate the current state of medical care, and how to remember to be grateful. Also, never take anything nor anyone for granted. If you take a look here, Haiti is right there, east of Dominican Republic. It's also located on the southeast coast of Cuba, and Cuba is right here. And there's 80% of the population of Haiti who live under the poverty line. There's 1 nurse and 3 physicians for 10,000 people in Haiti. The maternal mortality rate is about 300 deaths per 100,000 births. In the United States, that number is only 6 per 100,000 births based on the last census. In terms of infant mortality, we have 92 children dying per every 1,000 children being born. And also, who are the most vulnerable population in Haiti in this situation would be the pregnant women and their children. Now, this picture shows us how flagrant you can see the differences between the haves and the have-not, those who really have it and those who don't. On the left, we'll see how there's a party at the beach with fruits and veggies and crabs and everything. They're happy, they're having fun. And on the other side, you'll see this little kiddo doing his homework on the side of the street. I actually took this picture while while we're coming down from the Citadel on the donkeys. He's happy doing his homework on the street, and his older sister is supervising the homework, and he's happy despite not having a table or even food to work. And I thought that was pretty interesting. Now, I'm sure a lot of you remember the massive earthquake that affected Haiti on January 12, 2010. So that earthquake was a 7.0 magnitude. And I'm sure you've seen on TV the damage it caused. If you think about it, it's 300,000 people died in just a few seconds. So that would be the entire Rockford population and its surroundings. If you think here in this room, we'll be here today, and all of a sudden we're done. 2 seconds, we're gone. Okay, this was massive, and these are some pictures of how people were affected. So if you see on this side here, there's a bunch of So you're gonna see a lot of people who, after losing their home, they're sleeping on blankets, and some of them on their tents in front of the palace, the White House, and they also sleep under the stars, rain or shine, regardless of rain or sunshine. Okay, and that was many cases. And at the bottom, you will see how this woman is crying, running to carry her bleeding baby who was hit by the rubbles, and trying to find a place to take the baby to get the help the baby needed. Here on these pictures, you will see behind the crucifix, the cathedral collapsed completely, but it's interesting to see how only the crucifix stand and the cross. That was pretty interesting. Next, you see this little woman here. Why do I keep doing this? Sorry, guys. So we have this lady here having her arms up to the air, asking, what do I do now? I have nobody. This lady was the only survivor of her family of 10. Everybody died under the rubbles in the earthquake. And down below, we have this little girl here holding her younger sister, not knowing what's going to happen next, where to go next. And here, this little boy probably could be 6 or 7 years old, holding his little sister after the earthquake with his hand, wondering what's going to happen next in the next few seconds. So this was a situation of many, again, 300,000 people affected. I'm going to pass over the microphone to Dr. Plett to talk about the cultural differences in healthcare.
Thanks, Martine. So the hospital that we went to last year, and then that we'll be returning to, is Hospital Justinier in Cap-Haïtien, Haiti, on the north coast of Haiti. It's the equivalent of like a county hospital here in the United States, so public hospital. This is one of the picture here is one of the 4 sections of the maternity ward. This is actually where people were pre-op area, so where they were waiting to have surgery, or if they delivered and were just being followed up after surgery or after delivery. In Haiti, the patient and the family, or at least at this hospital, are responsible for bringing in all of their required medical supplies. So that includes IVs, IV start kits, the actual lidocaine that they would need for any procedures, their own Foley catheters. They actually went to the pharmacy, bought them, and brought them in with them. If they didn't have them, the surgery got canceled. So it was very different than from here in the U.S., where everything is just ready at the hospital for you. And so as the result of that, if you couldn't afford to buy those supplies to bring them in with you, then you had your baby at home. And we actually saw a lot of evidence of when the patients, after having a delivery, if they needed a repair of a laceration, we would have to wait for the husband to go and buy the sutures and the lidocaine until he could return for us to repair the laceration. So this is another unit on that same in the same building. On the right side of that picture is actually the hallway. They had run out of space, so they had patients in the hallway. She was actually a patient who had postpartum eclampsia, so she had a seizure after delivery due to high blood pressure, and ended up basically comatose. We really didn't see any response from her for the entire week we were there. And our last day or two when we arrived at the hospital, we noticed she was gone and wondered what had happened, and they said her family had actually taken her against medical advice home. Probably to pass away, unfortunately. On the left side of that picture is actually the Preeclampsia Unit. Preeclampsia is very common in Haiti, and so those are all patients who are pregnant, waiting for their delivery of the baby while their blood pressure gets monitored. And that was a typical unit throughout the hospital. This was the OBGYN building, but every unit looked like this. The walls are open. There's no privacy of any sort to speak of. So also some things that were very different between the two. On the left there is Dr. Schulteis, Dr. Holden, and Rennie working on a operative note, trying to translate a history, I think from French, trying to figure out what was going on with the patient. So everything there is paper, and you're lucky if you can get a history, versus here where you can pull it up in 2 seconds and have histories from all over. And then on the right is actually a surgical procedure, a D&C. In the U.S., we would do those under general anesthesia. The patient's completely asleep. In Haiti, they got a little sedative, and they were completely awake while we were doing it. And to my amazement, they didn't really complain at all. So very different there than here in the States for sure. Another thing that was very different here, if we say stat for a C-section, the baby's out in 30 minutes, kind of, or less on average here in the States. You'll see a video of a stat C-section in Haiti, a very different in the next video, but it's very much based on the availability of resources in operating rooms. Procedures that would be considered urgent here, like an urgent C-section or an ovarian torsion, don't happen with the speed that they would here in Haiti. We had a patient that we operated on for an ovarian torsion that had one for 3 days. Here we would have that surgery in 3 hours. Same thing with an ectopic pregnancy. We had a patient that had walled off for ectopic pregnancy 4 or 5 days, I think, was, if I remember right. So that surgery was very different than what it would be here with a lot of adhesions and more bleeding and such. Now hopefully this video will play. Yeah, so this is a video. The operating room that was available was not in the building we were in. So we had to go outside through the parking lot to get to the operating room. That's her IV pole, her IV bag. This was a cord prolapse, so the doctors, they're sitting on the bed holding the baby's head up off of the cord. So again, not at all what we would expect in the U.S., just going down the hallway to the C-section room that's available all the time. So, and then this was the building where the other operating room was, the general surgery building. And you'll see here on the left as we actually pull the bed into the operating room, there's actually patients sitting there waiting for their surgeries. So again, no privacy whatsoever. Those 3 people on the left are the next patients. So very different. And then that baby actually died and didn't make it, which would be pretty unusual here in the States, but unfortunately relatively common in Haiti. So Dr. Holden, I think, is talking about embracing priorities. Turn it over to him.
They did have an anesthesiologist, but she was just there out of the goodness of her heart. She's actually retired, came in to help us out because we were volunteering as well. They didn't have general anesthetic. They had a spinal, and these, you'll notice the OR lights are not exactly what we would find in our modern operating suites. And in fact, much of the time the power would go out and we were under the spotlights of cell phones that the medical students would hold them up over so we can actually see what we were doing. There were one of the reasons why we were there was to bring laparoscopic instruments and equipment, that is, to do things in a more modern fashion. Unfortunately, they didn't have the ability to do insufflation with CO2 gas, so we had all this equipment and couldn't use it. Instead, all of the procedures we did were open cases. And of course, open cases would entail greater blood loss, greater risk for infection, more pain during recovery. The remarkable things about these wonderful people is, again, not a word of complaint was ever whispered. In addition, the blood banking left a lot to be desired. It was very interesting. They had no in-house blood bank. The Red Cross had their blood bank 3 blocks away. Lenny was kind enough for one of her patients to go and donate blood. I tried to, but they said I was too anemic, and that disappointed me greatly. And then I got back to the States, and they told me I was just fine, and I donated a double RBC thing. I was like, I guess they just didn't like my blood. No. Let's see. Oh. Embracing priorities. Okay. Did you want to talk about fetus baby or?
Sure.
Okay. This is too important for me to not get this properly. What? Well, you'll notice that the baby appears to be very pale. That's not pallor. It's meconium. It's pea soup thick meconium, which is not an uncommon thing. Dating in prenatal care left a lot to be desired. So people came in labor when they came in labor. And very often it was post dates and after baby had a bowel movement in utero. And this is the result. So, please.
So to continue the same line as what Dr. Holden was saying, I'm just going to tell you my experience with fetus baby. I'm sure many of you women who are watching have had babies and are excited about the baby shower and what's going to happen. They're anticipating a baby to arrive, but Fida's case was different. Fida was a 20-year-old G1P0 female, of course HIV negative. We always make sure that all the patients that were actually, the students we work on are all HIV negative. She did not have appropriate prenatal care like Dr. Holden mentioned, but we did have this basic information. So Fida came in labor. We were getting ready. Everything was going fine with her baby, and all of a sudden, like I said, when the baby came out, baby was had a meconium tinted amniotic fluid. Apgar was about 2, so we would try to resuscitate baby with the minimum of what we have, like syringe bulb. We did not have the electric suction to get the meconium out. We did not have in intubation, none of that available. So we had to use manual resuscitation techniques to bring the baby's Apgar from 2 to a 6 and 7. We did ask for help, and the pediatric resident Ryan asked for the chief pediatric resident to take the baby to the NICU. So after the baby was transferred to NICU, baby was on oxygen, and okay, we thought everything was going fine. Before we left the hospital that day, after a long day of surgery, deliveries, morning reports, we went to watch the baby before we left, and baby was doing well on oxygen. The next morning, we went back for another busy day. At morning report, we found out that the baby died. And everybody was shocked, finding what happened. How did the baby die? So after morning report, went down to see mom, and mom had never had a chance to see her baby, hold her baby, none. The grandma was there. So then I asked the grandma what happened, because grandma did go to the NICU to see baby. And she told me there was a blackout, a power outage. So the baby suffocated. The oxygen mask was on baby, never received oxygen, and baby died because of the blackout. This is something that would have never happened here in the United States at all. This baby could have survived. This baby could have had life, the gift of life that we all deserve. So this is one of the reasons why I really feel like we should do something to keep this rotation going, maybe make a little bit of difference, even if it's not huge, to keep many other fetus babies alive just from a blackout. This is unacceptable. And every time I think of Fida, I tend to choke up a little bit, but I'm trying not to this time. And thank you for listening.
I'm Rennie. I'm one of the medical students who had the opportunity to go on the trip. And for us, I'm speaking for all of us who were there, it was a lot of different types of experiences. So we had really sad experiences, like what you just heard about Fetus Baby, but we also had some really wonderful experiences. One of the great things we were able to do is learn different history and physical exam skills that we don't necessarily get to use here in the States. So on the left, you have electronic fetal monitoring, which is nifty, and we just get to stare at our computer screens here in the States and see how a baby is doing. And in Haiti, they don't have that, and you get to try and listen for a baby's heartbeat with your stethoscope, which I was not able to hear because my ears are not that good. And then you have to plot them on a labor curve, which is an experience that we would never be able to have in the States. So this is Claire actually listening to fetal heart tones with her stethoscope. She did have good ears and was able to hear them. We also had really enjoyable times. There was, at the lovely home that we were staying at, there was a tree where we were able to get Wi-Fi. It was the one spot. It was therefore named the Wi-Fi tree or the Wi-Fi tree. That's where we're standing in front of. And as previously mentioned, sometimes there wasn't enough directed light available. So we got to do repairs and procedures under the help of a flashlight, which is why we all kept our phones in our pockets. It's the one time it's okay to have your phone out on a rotation is when you need it for lights. So that's, I think once again an experience we would never be able to have here. So we also learned some really important skills. We had to be very creative, be very flexible, because things can change and they might not be occurring in the way that you would want them to. So kind of as we spoke about before, things that we would want to occur very quickly, it may not be possible for things to happen at the speed that we would want to. The top right there, that's how we traveled. There's more people in that car than would be legally allowed in the United States, but we made it work. And we always had a good time. The road that led up to the house that we were staying at was not finished, so we had to walk, and it was quite a steep hill, but it was a good workout to get in every day. So you just kind of had to roll with the punches when we were there. Other really helpful things was speaking French and or Creole. I spoke neither, so not helpful to have that skill. But you kind of have to just manage with what you have. And you had to realize that you would experience really high highs and really low lows in the same day. The morning we found out about Fetus Baby, we were all crying in morning report. And then maybe not even an hour later, we went out and gave toys to all the kids that were in the hospital. That's what the picture is up there. And that was just the complete opposite of what we had going on previously. Is this still me? Cool. So we also got to participate in surgeries and wear really cool scrub hats, thanks to Dr. Platt. We got to give presentations to our attendings. And you got to take pictures with your specimens, which is not something we're allowed to do here, but something Caitlin was very excited about. So we got to participate in morning report. We got to hold our babies after they were born and take pictures with them. And I got to donate blood to a patient, which is, like, you can donate blood in America, but you don't get to, like, see the person you're donating blood to receive your blood. So that was really cool. That's Dr. Platt holding her first French operative note. Very I can't write in French, so that was very impressive. Dr. Holden gave an entire presentation in French. which was very impressive. And we got to practice knot tying as well. So lots of opportunities, not only for physicians, but also for medical students to be exposed to things that they would never be exposed to otherwise. And we also did get to actually leave the hospital and see the rest of Haiti. So we got to go to the beach and relax. So while we did work very hard, we also played very hard and had a good time. And we learned, most importantly, never to take anything or anyone for granted. This is our favorite picture of Dr. Holden chilling on the beach there. But yeah. Cool. And that's all of us. We take donations for the trip. Everything you see pictured here, plus more, was donated to us and then donated to the hospital we were working at in Haiti. Surgical supplies, gloves, sutures, anything that's not expired, we'll take all of it. Even if it's not surgical, they can use it at other parts of the hospital there. So, yeah.
There's one more slide.
There's one more. Oh, I'm so sorry.
Who's going to do what? There was one before this? No? What about that?
I think that's it.
Do you want to say anything?
Yeah. So it was, well, truly to sum it up, it was in 1 week, I went through medical school, residency, or internship, rotating internship, residency. I've been in practice for 25 years. And in 1 week, again, we had more emotional highs and lows than the entire time here in the States. We had 3 babies die in 3 days, the first 3 days there. We had that one woman who came in the morning we arrived with eclampsia. I've seen that before. We had the ability here in the States to immediately treat those patients, and I've seen them recover. This woman, her lying there in the hallway was their ICU. But unlike here in the United States, where ICU means intensive care unit, there it means I see you, and that's it. That she was in the middle of foot traffic, so people would be able to see if she was still breathing, that she was not convulsing, that she was making urine, that she was still somewhat alive. But after 5 full days, she made no progress, so the prognosis was quite bleak. And she was, if we had the ability to perform an electroencephalography, we probably would have seen that degradation of higher cortical factors. So it was a very sobering thing to remind us that why we work so hard here in the United States to deliver excellent care, that we need to be kind, compassionate, and diligent. The Haitian people are wonderful, incredibly appreciative, and I look forward to our next opportunity of serving them. So, thank you very much.
So this is the end. We thank every one of you who were able to make it today. And I know some of you are looking at it online. We're videotaping it. And again, to continuing the line with what Dr. Holden was saying, we're very grateful to what we have here in the U.S., but also I would like to remind everyone to remember to be grateful for also what you have every day. And also would like to remind everyone that most of our donations, I'm just going to go back one more slide, that most of these donations were from, 90% were from OSF, and about 10% were from Rockford Memorial Hospital, or Mercy now. We did a package party, and these are all everybody who was there to bring them all to Haiti, and all were in use when we were in Haiti. So we just want to thank everyone who contributed, especially, again, like I said, OSF and RMH. Also, being a family physician to OSF, you're probably wondering, why am I doing this with an OBGYN rotation? The reason why is because I respect all specialties, but I have a particular weakness for OBGYN and family medicine, because we all have to be born somehow to be part of a family. So being born in a healthy way with OBGYN, bringing us to life, to the birthing process, and family physician coming in and be part of a family, I think there's a relationship between these two specialties. And that's why I'm here today, and that was my role in this rotation, to coordinate it. A healthy family leads to a healthy community. And our goal is to not only do this in Haiti, but also here at home in the United States, at work, every day in our community, in our classrooms, and to be grateful once again, to thank God for what we have, and never to take anyone nor anything for granted. Again, thank you, everybody. If you have any questions, you can contact us, or you can go on the UIC Facebook page. Thank you.